It's a Kingfab Charity Foundation. I am head office or Kumasi Adumenu. Ya Primo Confonachi Teachings Hospital. Your D3 unit A or share and you are nominated of former Sabsabio or Monya stroke Yadiano. A year in your Bemak Kings a J. Frempon or that foundation ano. And now a radiado so boan for Bebre, and then no, ya do stroke unity. Or Basse or Baba Boa, and you are no more mother with some small amount to be a bit me so abo more or more a shemukakra. The science, yene doctors no be doing come na ya ho kwanya ya de no so e fa so esitie ene bra ene pa e bra ya de. Good morning.
Good morning.
May I know your name?
Dr. Gideon Emisa.
Okay, Dr. Gideon Emisa. I wanted to know how the stroke is.
What?
Can you explain how the sickness is?
So when it comes to stroke, how do I explain it in simple terms? So most of these patients here, they have certain issues with their brain. Stroke comes in like two forms. Either you are bleeding in your brain, or there's something blocking the blood flow to your brain. So as we can see from most of our patients, that is like the basic thing that we have. So for us to confirm stroke, we have to do a head CT scan. So the head CT scan will help us to tell if the person is bleeding or there's something blocking. And then some of these patients will also have to come with signs. Some of the signs could be that their speech has changed. They have weakness on their sides of their body. Sometimes it could be a part of their face, their hand, their arms, their limbs. They stop walking as they usually would, or they stop talking, or sometimes their attitude or their demeanor changes. Yes, so.
Okay, may I also know some of the challenges that you guys face here?
For the challenges, I'm quite new on the ward, so I'd like to hand over to my colleague here to tell you more, because he has been here longer. Okay, so Brother Philip.
Okay, Brother Philip, that Dr. Philip, we wanted to know some of the challenges that you guys face here.
Thank you. Most of the challenges we face here mostly has to do with the machines that we use and the equipment that aid us in our functions to help patients and also help staff from injury and also easy mobility, in assessing patient strength and everything. Sometimes you might need an electronic hoist which aid us in helping patient in and out of the bed and also ease the physical strain on patients. And also you might also need a second study, which is also assisting patient in and out of the bed and also assisting in their mobility in and out of the hospital. Sometimes most of our challenges right now is something called pneumatic compressive machine. It's something that you mostly, because the patient they are mostly dependent in the bed and immobile in the bed, they sometimes develop something called deep vein thrombosis. So, and it has certain also detrimental effects in pulmonary embolism that can also cause certain major health issues to the patient because of their constant immobility in bed, even though we change positions most of the time and we do most of the physiotherapies, but it's still an integral something that we have to pay attention to because it is increasing with time. So that kind of equipment help us to prevent that from happening. So that one too is a challenge, and also one of our challenges to the general day-to-day care for patients and how to prevent the prevalence or at least reduce the effect of the stroke, the frequencies and stuff like that come. So we also find firms and agencies and organizations where we also do the outreach for patients and to reach out to the larger population to help with the management of stroke, and also they know the risk factors of stroke and ways and means we can prevent, or even if there is a stroke, how do we manage it, how do we do the rehabilitation, and all those focuses in the way that is best possible for us. So basically these are the few things that we are trying to do it here. And you might also need air mattresses. Right now it's relatively expensive for patients to purchase because of the fee attached with the service. A piece is around 1,000 Ghana cedis. So sometimes patient has to buy to also prevent these bed sores from happening, because bed sore, can increases the mobility of patients and the mortality issues when it comes to stroke patients. So mostly in major advanced stroke faculties, every patient, the system provide the air mattress for all the beds and every single patient on the faculty. But here they have to buy it. It's around 1,000 Ghana cedis. It's relatively expensive. Not all can afford. So sometimes the world finds ways and means to also support such patients in that regard. We cannot do it for all patients, but at least the ones that we try, at least about 70% of them, we do our best. Even here, I think you can have like three patients who are on air mattresses. That was provided by the ward. I hope you get it. So sometimes, and because of the constant usage, they wear and they tear. Some get burst, some get torn, and we have to find ways and means to replace them. And it's all money. I hope you understand. And we don't have the support, so sometimes you get support and aid from you guys. You also had support from people philanthropists who want to come to you and see what is being done in that regard. So I think mostly that is what the situation that we are dealing with. Yeah.
Okay. We say a big thank you to Dr. Enoch. That's what some of the challenges that they are facing here, that what he has brought it out. As you said, we will discuss with our boss too, and I hope and believe by grace of God, as he had the heart to come here and support our dear brothers, fathers here. I hope and also believe that as he listens to or watch the video, he will do his best to come in your aid to support in whatever you guys need, so that it will make your work easier for you guys. So
yeah, I'm most grateful on behalf of my bosses. How will you come? He's my boss, so let me continue.
Okay, we'll ask the boss. Please, may I know your name?
My name is Habib Abdullahi.
Okay, so as your colleague or your brother have said, I want you to also add something a little bit to it for us.
Okay, I would like to appreciate our former patient who have seen it good to come here and do donation to our patients and to help in their recovery. As my colleague already said, we have a lot of challenges here, and that's why we're spelling them out, so that in case another person see it as a good thing and want to follow the suit, he will take our advice or our challenges and try to help the world. But we would like to really thank him so much. And as he already said, most of our challenges are on the patients and their relatives. And as he's doing that, we really appreciate it so much. Thank you very much.
Okay, thank you very much. So as we have already said, we are here to support our fathers or brothers, our family here. So we thank the doctors very much for sharing their views or concern about this sickness. As you are watching us, we are urging you to also take very good care of yourself, so that you will not get into that, because it's not easy. It's not easy being here. We thank you very much for accepting us. We are here to support them a little bit, so that they can use to buy some drugs or anything that they need. So that's why we came here. All that we are saying is, may God bless them and bless you, the doctors and the nurses, for the good work you guys are doing. We hope this is not the end. We will come and support you guys with what you guys said. May God bless you all. We thank you very much. So